Hello, good evening. Can you all hear me?
Yes.
Yep, excellent. So my name's Jo. I'm the Continence Advisor for iMEDicare. So I'm going to talk to you briefly this evening about products for successful continence management with LUTS in men. My slides are moving. Oh, sorry, beg your pardon. So a little bit about iMEDicare. iMEDicare is a dynamic and rapidly growing medical distributor offering an exciting and unique range of medical products for continence and urology. So just to let you know, due to the time limitations this evening, some of the slides shown will only be on the screen briefly, but as this is recorded, you can go back at your leisure and study them in depth. So lower urinary tract symptoms, or LUTS. So this refers to a broad spectrum of issues, including urgency, frequency, nocturia, hesitancy, weak stream, incomplete emptying, and post-void dribbling. And this affects 40% of men 50 years and over. So these symptoms are often due to multiple underlying issues with common causes such as prostate enlargement, bladder outlet obstruction, detrusor overactivity or underactivity, and post-surgical changes. So incontinence, especially residual leakage or dribble, adds a significant burden, affecting hygiene, clothing choices, and emotional well-being. Now, LUTS symptoms do fluctuate, making flexible, non-invasive management strategies essential to support dignity and independence. So clinical investigations and diagnosis is, of course, essential with LUTS. But looking at the conventional product solutions. So disposable pads, now these are convenient, they're often free on prescription, but they are typically designed for female anatomy, where the gap between the urethra and the anus is fairly standard, but not so with men, which can lead to poor fit and discomfort. There's also a resemblance to menstrual products that can affect confidence, while bulkiness and visibility may impact dignity. Pads may saturate too quickly for high volume leakage, and over time become costly and a challenge environmentally. Indwelling catheters and intermittent self-catheterization serve different roles and should be considered separately. So indwelling catheters offer continuous drainage and are useful in complex cases like retention or high residual volumes, but they carry a high risk of infection known as CORTI and should only be used when medically necessary. ISC is preferred for management of retention and overflow incontinence, though it's not effective for stress incontinence. And both methods are invasive, may cause discomfort, and require ongoing supplies, training, and monitoring, adding to lifestyle impact and care complexity. So sheaths, the pros of these, they work really well if they're fitted correctly and they're available on prescription. And the cons to this is training is required, and applying a sheath to a retracted penis is challenging, as a limited surface area reduces adhesion and increases the risk of leakage. So it's about finding the right product at the right time. So no single product suits everyone, nor even one person all of the time. So iMEDicare have a range of products to help with LUTS, and this is a brief overview. So let's look first at the environmental impact of pads. Billions of disposable pads end up in landfill each year. Washable alternative eliminates this waste, lasting through hundreds of washes. Disposable pads often contain plastics that take centuries to break down and depend on constant inputs like wood pulp, plastic, and chemicals. Washable alternatives use eco-friendly materials that reduce long-term environmental harm. So this is the stylish washable wherever range for men. This is reusable, washable underwear with built-in absorbent layers. This is for light to moderate leakage for use with stress incontinence, made from cotton, which is also sustainable and biodegradable resource. And these are available in a range of sizes, styles, and absorbencies up to 650 mils. And this shows the details of the pad that's built into the briefs. And this gives a bit more detail and the order codes. So we've had a look at some cost savings using the Wherever versus the Tenor Comfort Mini Super, which is a basic pad and frequently used on prescription. So this is based on 1 year using 3 pads a day, which is not a particularly generous allowance. And this costs £197.80. The cost of Wherever is £63.77 a year, and this is based on one pack of 7 pants. So this shows a cost saving of nearly £13,500 for 100 patients over a year. Also a reminder, as 1 pack of 7 pants can last 5 years, this is a huge reduction in landfill too. So this is the pacey cuff, and this may be new to some of you. Now this is the only product I'm showing to you that requires a private purchase. So this was invented by vascular surgeon Dr. Pacey due to the concern of the use of penile clamps and restricted blood flow. So this is an external urethral cuff or compression device which compresses the urethra to preserve continence as well as blood flow, and is safe to wear for 24 hours for stress incontinence. This is a published study that was carried out at the Royal Berkshire Hospital in 2024. Now this really is a very interesting study, so please do go back and read it at your leisure. So this study was on 14 people and the average age was 75. And looking at the conclusion here, the most significant findings for me was that there was an 89% reduction in the weight of the pad over a 3-hour period, but no decrease in penile oxygen levels. And this is available in a variety of sizes to suit most gentlemen. This is the AFEX system. This may also be a new product for some of you tonight. This is an external collection device that provides continuous collection of urine in a discreet, less invasive way, so no adhesion is required. This shows the jockstrap design, and this keeps the receptacle close to the penis to help with retraction. And underwear can be worn over the top for comfort. This shows the receptacle in a bit more detail, and also the variety of ways AFEX can be used according to the lifestyle of the gentleman. This is most commonly used during the day and works well for all types of urinary incontinence. Most importantly, it's available on community FP10 prescription. And lastly is the men's Liberty. So you may have known this previously as Bioderm XLS Oval. So this is an external penile sheath for all lengths, including retraction, that directs urine into a collection bag. And although this picture is shown with the bag attached, it's also available as an option of attaching any bag. This is for patients with significant leakage or urge incontinence who require continuous collection. Importantly, there is no need to measure, so no need to order and store quantities of different size and style sheaths. The next 2 slides show in detail of how to apply it, so you can come back and view it later. So sometimes known as a petal sheath. So very briefly, the foreskin's brought back and the petals go over the top of the gland. And there's a second layer to seal this in place before the foreskin is replaced. And this is the prescription advice form where all relevant codes can be found. So men with LUTS often face distressing symptoms, and traditional products have their limitations. The iMEDicare portfolio offers a graduated and less invasive and anatomy-friendly options, improving comfort, dignity, and skin health. Importantly, though, these devices don't breach the urethra or bladder, so the risk of damage to urethral tissue or introducing pathogens is much lower. And of course, gentlemen also have the choice of using these products in any combination, depending on the day's requirements. Importantly, though, proper patient selection, fitting, user training, and awareness of limitations are essential. Ideally, these devices do not replace all other options, but simply expand the toolkit, allowing clinicians and patients to tailor a management strategy that is less invasive and yet effective. So iMEDicare offer telephone and video support to patients, home visits, and training to care staff free of charge for all of our products. And this QR code shown here takes you through to an encrypted form to refer your patients throughout the UK and the Republic of Ireland. I know this has already been addressed, but if you do have any questions, pop them in the chat if you can, and we'll either answer them at the end of this time, or please feel free to email me on the above email, and I'll get back to you. So thank you for listening and enjoy the rest of the presentation.
Thank you, Jo. I forgot to say earlier, sorry, that this will be recorded and will be available on the members section of the ACP website. So next